So, welcome back to another edition of the Heart to Heart podcast. And my guest today is the Honourable Tony Clement. So, Tony Clement is a former health minister and he's now an entrepreneur. So, Tony, welcome to the show.
Hey, it's great to be on the program, Mike.
Well, thank you so much for having here. I know that, I just kind of did a very brief intro to you, Tony. So, if you could just tell the audience a little bit about yourself, that'd be great.
Yeah, no, it's been quite a journey, lots of different twists and turns in my life. Started out as a lawyer and a business guy, did a lot of work in Central and Eastern Europe in the early 90s, and then caught the political bug full time, ended up in the Ontario legislature in 1995 as part of the Mike Harris government, became Minister of Transportation, then Minister of the Environment, Minister of Municipal Affairs, and then finally Minister of Health during the SARS outbreak in 2003. Then went on to federal politics, was elected in 2006 for the great riding of Parry Sound, Muskoka, and became Stephen Harper's federal Minister of Health, then Minister of Industry, then President of the Treasury Board, which I liken to being like the COO of the government, and then moved into opposition, and then finally out of Parliament in 2019, where I sort of rekindled my love for entrepreneurial life, and I'm involved in a number of tech and healthcare startups, as well as doing some consulting, and got my media interests, including my own podcast and Another Thing podcast. Yeah, it's a busy and varied life. I'm enjoying it.
That's awesome, Tony. It's it sounds like you've done quite a bit in your life. But what I wanted to quickly ask about was what was the last part. You said that you just got involved into some startups, particularly in the healthcare space. And I know one of them is with OptiMind, which is a company that's focusing on psychedelic enhanced psychotherapy, with a particular interest in growing psilocybin mushrooms. So which are magic mushrooms for people who are not familiar. So I was just wondering, Tony, how did you get interested in psychedelics, and how did you get interested in OptiMind?
Yeah, no, it's been quite a journey on that front too. People may remember, as part of the Harper government, that we had a slightly different strategy when it came to drug use. But I think that a lot has happened, and my views have evolved over time as well. And really, because of I had a bit of a mental health crisis about 3 years ago now, and became much more interested in mental health and mental wellness issues. Not that I wasn't before, but when it affects you personally, that raises awareness for sure. And although I cannot make any claims, I'm not here to give any market advice or any health advice. I do believe that in my own heart, that psilocybin, taken responsibly, can be part of the solution when it comes to mental wellness, reducing symptoms of trauma, reducing PTSD, reducing anxiety, reducing suicidal ideation, those kinds of things. So that's kind of how I view it now, and I'm not the only one. Obviously, we're going to have a lot more research, but certainly it can be part of the mix of solutions, I believe. So that's kind of my view. Now, Mike, I kind of came at this through as well another psilocybin company, Todd Shapiro's Red Light Holland, who invited me to be an advisor to them as well, and certainly learned a lot about the industry through that involvement over the last 15, 18 months or so. So I come at it with the view that this can be helpful to people, and that even recreational use, used responsibly by people that are using it responsibly, can be helpful to people as well. And so I believe that is where also the public is going on these things. They look at these, what are essentially natural products, with a different light now. Cannabis was the first, but certainly will not be the last. And so as attitudes change, and people are looking for other healthcare and mental wellness solutions, then psilocybin certainly should be looked at.
Excellent. Yeah. And I feel the same way. And, I've discussed this on the podcast before, so I won't go into too much detail, but, basically we've been using the same class of medications, SSRIs, selective serotonin reuptake inhibitors, for, a long period of time now. It's been 3 or 4 decades, without really introducing very many new classes of medications to address mental health. And that's where I feel that psilocybin can come into play, because we're doing something different. And as we know, there's a lot of people who have what we call treatment resistant depression. So those are people who are depressed. They go see their family physician or their psychiatrist. They get prescribed SSRIs or something similar to that, and then they don't get a response. They still end up being depressed. So for those people, I think that we should be looking at different classes of medications. And also too, Tony, I'm very happy too that you mentioned about research, and you're probably familiar with the study that came out maybe about a month ago now, maybe a little bit more, in the New England Journal of Medicine, that compared psilocybin to Lexapro. And then they did say at the end of the study, they concluded that basically psilocybin was just as effective as Lexapro. And that was a good study, and it was a big step. I do think though that some of the research in that study and some of the conclusions could have favored psilocybin a little bit more. And I don't think I'm biased in saying that. I have my reasons for saying that. Um, the reason, a couple of the reasons being is that, as you probably know, the study was about 6 weeks long, and the people in the Lexapro group, and Lexapro again is a selective serotonin reuptake inhibitor for people who are not aware. They were taking this every day, whereas the people in the psilocybin group, they only took the psilocybin 2 times in that period.
Right.
And actually, and at the end of it, their depression scores in the psilocybin group were actually 2 points lower than in the Lexapro group. Yet, still they said that they were equal overall. And if you do look at some of the secondary outcomes as well, it did show that psilocybin was more effective for improving general mood and reducing a lot of symptoms of depression. So, even though the trial was very favorable overall, in terms of enhancing psilocybin and giving it some legitimacy as a medicine, I do feel that even in that particular study that we have, the outcomes were actually more favorable to psilocybin overall, even though that again, they indicated they were equal. So my question then becomes, like, do you feel that the reason that we're in a position now where we're still advocating for psilocybin and it's not being prescribed, say, across clinics in Ontario, do you feel that it's because we're still have a lack of a research, and that Health Canada wants more research before we should be prescribing these medicines?
Yeah, I think that more research will be helpful, and I know that there are trials that have been applied for, and I'm sure undoubtedly there'll be other clinical trials that'll be part of it as well. And Health Canada is taking a step-by-step approach, which is not unusual. They did the same, the whole thing about cannabis. Most people look at cannabis legalization as a big bang event, but it really
Mhm.
wasn't. It was the culmination of a decade and a half of research, and then medical use of cannabis being allowed. And then when I was health minister, it was this crazy system where the Health Canada bureaucracy said, well, the way we're going to allow for medical cannabis is we're going to grow it in a mine outside of in Manitoba, and it's all going to come from this mine, and that's the only place you can get it. And of course, when government runs things, it doesn't necessarily mean that it's going to be A1 product that's going to be useful for everybody. But that was how they created this monopoly situation with this product that was not, shall we say, useful for everybody. But that was their approach. And from there, and obviously that was not very helpful to everybody. From there, we got to full, not only legalization of medical products, but also recreational use of cannabis. So as I say, that was not a big bang. It wasn't one day we were doing this and another day we were doing something completely different. It was part of a progression, of an evolution of thought. And let's face it, public kind of flipped on this. If you look at the polling on legalization of cannabis, it was 70% against in 2005 and 50% against in 2010. But by 2015, it was 70 or 80% in favor. And I think people are being very practical about it. First of all, cannabis was all around us. Friends, family, yourself were utilizing cannabis, so it wasn't seen as such a big deal. And psilocybin, although less prevalent than cannabis, even people my age know someone who has participated in that in some way. And so I think, and I think again, the idea that again, more research is necessary, but there is research being done. And I think most people's attitudes is, well, if it can help some people deal with PTSD or deal with mental wellness issues or deal with suicidal thoughts, why would we be against that? Because because it's a Schedule I substance historically. I mean, it makes no sense. So I think people are pretty practical about this, and that helps drive change, because Health Canada, and of course the Minister of Health is a politician, they're not going to do something if it's completely out of whack with where people's heads are at in terms of looking at this substance. But views are changing, and they're changing. And what I've noticed is it's not just an evolutionary change. It flips at some point. We reach a tipping point, to use Malcolm Gladwell's and others' formulation, and all of a sudden something that was outside of mainstream society becomes very mainstream. And I think we are at that point with psilocybin, again, because the practical reality is it can help people.
Yeah, and I think too that, and coming back to the research component, it is a little bit uh, tricky though at some times to do research with psilocybin, say in a randomized controlled trial, because I mean, obviously, if you give someone an SSRI or a placebo, and you give someone a dose of psilocybin that would cause them to have a psychedelic experience. I mean, obviously the subject is going to know which medicine that they took, right? So I think the only way to really do a randomized controlled trial legitimately, we would be to do it through microdosing. And microdosing, for people who are not familiar, would be to take psilocybin in such small quantities that you don't get any type of psychedelic effect, but you still get a medicinal effect that can improve your mood and various different parameters of evaluating your mood. So, do you see that being a little bit of an issue in terms of the advancement of psilocybin and it being accepted in the medical community? Because I'm not confident that we're going to be able to produce a ton of randomized controlled trials because of that issue. Do you feel that may be an issue coming forward, and do you feel like that has been an issue in the past, and why it's been difficult to research psilocybin?
Yeah, I mean, Mike, you're obviously more of an expert on that aspect than I. I'm a lay person when it comes to those things. But let me just say this. Looking at it from as a former minister of health, as a former politician, the more experience we have in clinical trials or random trials, the better. And it doesn't have to necessarily be just in Canada. I know that there will have to be some in Canada, but we're seeing this around the world too, and there's certainly a lot of headway that is occurring because these trials are taking place. Lot of work in the U.S. now, and obviously there's starting to be legalization in the United States as well, following the cannabis route. So I think that that's the most helpful for politicians to do this, because they'll be able to look at this, knowing that they're not. Let's face it, they don't want to be so far out ahead that if something goes wrong, that's not good. So I think that's where we are, and I think that's where we'll see the future. There'll be more and more trials. There'll be more and more experimentation, if you will. Microdosing again. I think there's a movement to look at microdosing, which is all good, and it's happening because people are not aware that microdosing is possible. So there's a bit of an education campaign that has to occur.
Yeah, I agree. I think that right now, a lot of people have some interest in psilocybin, but there's still a lot of people who just see it as, magic mushrooms. They don't see it as a medicine whatsoever. Just like a lot of people, say 5 to 10 years ago, didn't think that cannabis was a medicine. They just kind of, remembered what they learned in kind of like the grade 8 health class, so to speak, and just thought it was, something that wasn't helpful in any way. And now we're kind of finding out through research and through studies that, psilocybin, can be effective. And I think too, to your point earlier about, mental health, I think there's a lot of people who, just kind of got to a point where they were so frustrated with their current treatment and with how things were going that, they had almost no other option but to look at, some other substances, say something like psilocybin. And I don't know if anyone, Tony, personally. Obviously, you don't have to name any names, or even in your own experience, like, did you ever feel that there's a lot of different medicines that are being offered by the medical community, and I'm reading about this different class of medications that seems in psilocybin that seems to be very effective. You feel that there's people that are more and more curious now,
Yeah.
use psilocybin because of that reason?
Yeah, I think it's happening. I wouldn't say it's at the same velocity as what we saw with cannabis, just because a lot fewer people have had experience with psilocybin. And again, my earlier point, perhaps inelegantly stated, was microdosing is a new concept, right? So we do have to educate people on microdosing. So when you say psilocybin, and then people say, what's psilocybin? Then you say mushrooms, and then they remember that trip that they had on mushrooms when they were going to the Grateful Dead concert, and boy, what a trip that was. But that isn't what we're talking about. We're talking about medicinal usage, microdosing. It's not completely to separate mind from body here. So I think there's a bit of an education campaign that has to go on. But I guess the other point I'm making, though, is the public is getting ready for this, because the public is very pragmatic about this. If you can show it's going to help some people deal with some deep-seated issues that are affecting their mental and physical health, then why would you be against that? And the old argument that, well, it's a Schedule 1 and it has this historical taint to it, that's going away. I mean, the historical record of what happened in the 50s, 60s, and 70s, and Timothy Leary, and what you took at that rave 30 years ago, it's totally irrelevant now.
Yeah,
And
people just want something that works. They just want
yeah,
something that's gonna make them feel better. And if psilocybin happens to be that substance, then I think that, people are gonna become interested in it, and they're gonna, want to start to use it. And just on the note too of drugs, like, do you feel, Tony, that we're doing criminalizing all drugs? Like, do you feel that that's something that, should be brought forth on the table? Just because it seems like, by having a lot of drugs that are people are now being criminalized for, it does appear in some ways to be, affecting people's usage in a negative way overall. Like, do you feel that there may be a point in time in Canada where, we may look at, decriminalizing drugs so that, people can maybe get more help for their use instead of actually being punished for it?
right. So, I mean, important discussion. It's definitely in play now, as it has been to a greater or lesser extent for the last 20 years or so. Uh, I'm not sure I'm there yet personally. I do draw a line when I look at the impacts of heroin addiction, mainlining heroin, for instance. I think that that's so detrimental to one's personal health that you do want to dissuade that kind of activity, and you don't want people preying on other people by supplying them with heroin. So I do have some red lines still. I understand it doesn't help everybody, and I understand that the purpose of public policy should be to help those people. If you are an addict, you need help, and that punishment isn't necessarily the best help. I do get that. And when I was health minister, I had those debates, and because I was the minister that was trying to shut down Insight, which was the facility in downtown east side of Vancouver, dealing with a safe place to inject heroin. People felt that I was anti. Uh, I was against the idea of helping people if they were in that situation, but I just disagreed with that approach. But I did want to help those people. I did want to help them get off a terribly addictive and destructive drug. So, and I still believe that. And so I do draw distinctions, and I don't think it's helpful to the psilocybin community or the cannabis community to be associated with heroin. They're very different, and they have very different impacts on the human body. So I think those debates are happening. Yes, Mike, and I think they should happen. And we should look at it from the point of view of safety, of society, and of the individual who needs help. And we should be compassionate to those individuals, absolutely. But I don't think saying that cannabis and psilocybin are the same as heroin. I don't think that's true, and I think most doctors would say that's not true. So let's take these things not from an ideological point of view, but as you're saying, from a practical point of view.
Yeah, I think we need to take things slowly for sure. And, I fully agree with you. Obviously, cannabis and psilocybin are very, very different than heroin, because, cannabis and psilocybin have obviously been studied medically, and they've proven to have, great medical benefits. So it's kind of, even silly to compare the two. I guess the argument that people have with the decriminalizing of drugs is that they just feel that it may be safer in some ways, and that sometimes some of those people may face kind of some injustices that they
Yeah.
have been facing. But I do agree with you overall, though, that we do need to take things slowly, and that safety should be first and number
Well, I
one.
mean, harm reduction is an established area. Safe needle exchanges, are important, and safe injection sites are now with us in our society. But is that, I guess my question is, okay, that's been done, but how do we help these people if they need help?
Yeah.
And
Yeah.
I say that they do. So that we shouldn't lose sight of that. And there's a tendency in middle class society, if I can put on my social sciences hat for a second.
Hmm.
But I just don't want to warehouse people. I don't want, just because if you're a Vancouverite and you don't like stepping over an addict on your morning walk to work, so okay, so we're going to create safe injection sites. Okay, great, out of sight, out of mind. I don't have to worry about it anymore because they're at the safe injection site rather than sprawled out on the sidewalk. Well, I'm sorry, but because your guilt has been looked after, doesn't mean the problem has gone away. And I'm sorry if I'm feeling passionate about that. And I know that wasn't the original topic of our conversation, but I do feel passionate about it and compassionate about it because I want to help people who are suffering. And that should be, the role of a physician, the role of a politician, the role of society as a whole.
Yeah, and I feel, as I'm sure as you do, that most addictions, of course, there is a physically dependent, component to it, particularly depending upon the substance. But for a large part, a lot of these are psychosocial, issues, and they're not easy to fix. So, that's, I think, is one of the bigger reasons why it's so difficult to address these issues. Is because they're deep psychosocial issues, and those issues take a long time to address. And I do want to chat about COVID today, but just one last question um, about this. And have you ever thought of that Canada should have a place where we can test our drugs? So meaning that, like, if someone gets something illegally, should there be a place where they can at least test it to make sure that it's not laced with something, so that when they are taking something, they know in fact what it is, and that may be an effective harm reduction strategy.
Yeah, well, I mean, that's a very good point, and obviously the opioid crisis, it's got to be at least half that. That you don't even know what you're taking into your system because some malevolent actor somewhere has put other stuff in, and so I think that's got to be part of our harm reduction strategies. And I know I've known opioid addicts who have died because they miscalculated, or maybe even didn't care enough to worry about it, which is very sad and tragic. And we know during COVID that opioid uh, addictions and deaths has not gone away. In fact, quite the opposite. So this is a huge, again, one of these unintended consequences of COVID and social distancing and people not being able to check on one another to the same extent. That's created a huge problem because of opioids. So anything we can do to stop that would be good.
Yeah, I think that that's something that would be beneficial, and should be implemented as soon as we can. I think that the when you're looking at things, and talking about, like, the heroin, like we said earlier, like, you're looking at a risk benefit thing, and obviously, when someone is injecting heroin, there's a tremendous amount of risk there. And that's why you can certainly make the argument that even if they're doing it safely, the risk is still so high with the heroin that it's it may outweigh it. But when you're looking at something just like testing drugs, I mean, the risk of testing a drug, I mean, I guess the only thing that you could really say is that if they know that it's a clean substance, they may be more likely to abuse. But the benefit is that they're not going to be ingesting something that they know could could potentially kill them, very, very quickly.
Yeah, I would hope so. I would also hope, human nature being what it is, that that doesn't encourage risky behavior. So again, this has to be studied.
Yeah, I totally agree. And on that note, though, too, Tony, I know we only have an hour today, and we're already probably halfway through. I did want to chat with you about COVID,
Hmm.
and because obviously, it's affected us quite a bit, here in Canada and all over the world, and but in Canada in particular, and in Ontario, I mean, we've been locked down now for I guess about 4 months this year in 2020. I think in March we were kind of in in a gray or in a orange zone. I'm not really sure exactly what it is, but do you feel that the lockdowns have been something that has also increased drug use in Canada, and you feel that the lockdowns have been detrimental in some of the parts of in Canada in terms of creating more of an opioid crisis, or more of an environment where people are going to start using and abusing drugs?
Yeah, and look, again, this should be data driven for sure, and I think the jury is out on some of this. There was some initial evidence of increases in people feeling isolated, and increases in mental wellness issues. Then people were saying it's affecting our kids. Then there was counter evidence saying kids are actually doing okay. They're very resilient, and calls to the kids helpline have been down, not up, and so on. So I think that we have to have more evidence on some of these things. People are very adaptive as well, and so it's amazing how people will take a bad situation and count their blessings and find a way out. Having said that, I can tell you my own mental wellness. I've been frustrated at times and anxious at times, and so on. So and I know I'm not alone in that. And feelings of being cut off from friends and family. Haven't seen my mother in person since last October, as an example, because she's in a retirement home. So these things are not good. Intuitively, we know that. So. Look, lockdowns. I think that they were a responsible approach at the outset, because we didn't have a vaccine, and we were not able to stop at our borders new cases, and so in that situation, you have to try as best you can to reduce mobility and keep people as home as much as possible. My complaint is that, that just becomes, we were just in this whack-a-mole world where, lockdowns, then things lighten up because cases are down, then we go about our business, and then we have to do another lockdown. So we've been through this three times in Ontario, same in the rest of the country. And to me, it's like the old adage, when you're a hammer, everything looks like a nail. So you go to if you're a politician, you go to your public health advisors and say, oh my God, the cases are going up again. What should we do? And they say, well, we should lock down again. I criticize the lack of creativity. We know now, and we've known for months, that the greatest number of cases are coming from packed work environments with few sick day policies that are working. So why are we not dealing with that earlier? And we know that if those areas are vaccinated, then it greatly reduces the transmission. So why didn't we focus in on that with our vaccination efforts after we got our immunocompromised elderly people looked after? So in all of these situations, you should look at the real-time evidence as best you can. Why didn't we have better tracking and tracing? That the countries that did really well at this, I'm thinking Taiwan, South Korea, Vietnam, had really kick-ass track and tracing. So when you had an outbreak, you identified it very quickly, and isolated those people, and it didn't have an impact in the wider society. So lots of lessons learned. Because I was the health minister during SARS, I'm tearing my hair out because there were a lot of post-SARS. We had all of the navel gazing and reports on what did we learn from SARS, lessons from SARS, including making sure that our long-term care facilities had employees that didn't go from one facility to another because they were in part-time employment, not their fault. Give them better full-time employment with better benefits so they can stay in one space. That never happened. Secure our borders better. That was a recommendation. That never happened. So I'm tearing my hair out looking at all the lessons we learned from SARS, because we were one of the jurisdictions of the world that was affected by it, and not much was done. So very frustrating that way. And I do believe we're going to have to do a lot better job next time, because there will be a next time, on how to deal with these things. Canada, you know, we've been fair to middling. We're definitely not the worst, but we're definitely not the best. And we're a G7 country. We should be amongst the best, but we weren't. And I think we have to look at it with that cold eye of reason, and do better next time.
Yeah, it's I'm happy that you mentioned, SARS-CoV-1, and for people who aren't familiar, COVID is SARS-CoV-2. But yeah, like I've always thought, like there should be some type of committee or board that's kind of ready or on standby for when something like this happens. Like there should be some type of pandemic board in Canada and in Ontario, and so that people know, okay, when something is happening, when there's a new virus or something that's introduced, then we're going to go to these people, and there's going to be some type of plan or implement, or that we can implement right away. But it seems like we're just kind of flying off the seat of our pants, so to speak. We're just kind of making decisions without really evaluating as much data as we can.
Well,
I mean,
if
and
I may, I was federal health minister, and we developed a national pandemic plan, the first one, and that was back in 2008. Uh, but what's happened? Parts of it have been dismantled. The early warning system uh, in Asia was dismantled. The stockpile of PPE was dismantled. So, we initially learned a few lessons and then just sort of forgot about it and went about our business. Well, that was, again, a bad strategy.
Okay, so you're saying, and I know you said this earlier, Tony. So I should have mentioned that in the first SARS-CoV-1, there was some things that you guys learned, and then they were put forth to the government, and there was
Yeah.
some type of plan in place, and then all of a sudden, when SARS-CoV-2 came along, by those plans were just basically forgotten or not utilized. Is that kind
We
of correct?
actually had a local vaccine supplier. Now, that was for an influenza type pandemic, but GlaxoSmithKline was tapped and given a 10-year contract to produce in Canada vaccine. Uh, Now, why didn't we have one that was broader? For obviously everybody's using the RNA vaccine approach for COVID. Now, where I guess Prime Minister Trudeau did announce a vaccine facility for Mississauga for the future. But again, opportunities missed. The initial approach of the federal government was, let's partner with China on their vaccine. Then the Chinese kicked us out of that. And then we were months behind everybody else, or some of our peers, let's say the UK and the USA and others, because we put our eggs in the wrong basket. So, look, there's a lot of lessons to be learned. I'm not blaming the politicians, because I know how difficult it is to make these decisions in this situation. But the true crime would be not to learn anything from it, and then go back into this whack-a-mole world of lockdown release, uh, killing our economy and as the result, and obviously having an impact on mental wellness. So let's try to do better next time.
And I have to ask you too, Tony. I'm very interested in what your stance is on the vaccine passports. I don't think it's like unreasonable for for someone to not want them to come into their country if they're going to be infecting people. But at the same time, I that what exactly what I just said. I don't want anyone coming into our country infecting people. So that doesn't necessarily mean though that someone needs the vaccine, because there are COVID antibody tests, and COVID antibody tests also indicate immunity, right? Because that's the end game of a vaccine, is you want to make sure that the person has immunity. And you're probably now familiar with Senator Rand Paul, who's also a physician, who stated that he's not going to be getting the vaccine because he has tested himself for COVID antibodies, and he has those antibodies, meaning that he's immune. So, do you feel that there should be an immunity passport, or do you feel there should be no passport at all? Like, what are your thoughts on the vaccine passport in Canada?
Well, man, I'll be totally honest with you and your viewers. If having a vaccine passport is what I need to be able to travel again and to go to rock concerts again and to go to hockey games again, I'm telling you, sure, sign me up, because I want my life back, and if that's the way to do it, I'm willing to have that infringement on my medical privacy in order to do so. That's how I feel. And am I worried about other people being at the Billie Eilish concert who may not have been vaccinated? No, I could care less. So my own risk assessment is I'm willing to take risks. Now I'm double vax now, so I'm willing to take more risks, and go to the Billie Eilish concert versus staying locked up in my home with a mask on. I don't want to live that kind of life. So I'm willing to trade a little bit of my medical record to live that life again. Other people might make different calculations, and I respect that.
But do you feel though that the immunity passport, meaning like COVID antibodies, should be equivocal to getting a vaccine?
Well, if it's available, if it's readily, the problem with all of this is how readily available it is all of this. Because again, we've done such a poor job on tracking and tracing and testing that yes, theoretically, Mike, but I have no confidence in the state's ability, the state being the government's ability to pull it off. Because did you know, or do your viewers know that one of the problems with tracking and tracing and testing has been because the various provincial ministries of health have been extremely slow and reluctant to change the regs, which require that the testing be handled by registered medical professionals. So, these home kits on testing, not allowed. And that the governments have been sitting on hundreds of thousands of these test kits because of the bun fight that's been going on over scope of practice to administer the tests. We got to do better than that. The technology is there. Let's use it so that we can go live our lives. I'm willing to have a test every day, hopefully a little bit less intrusive than the nasal test, but I'm willing to have it every day if it means that we can congregate again.
I understand. And another question too I have for you, Tony, is do you feel that our health minister and all the politicians in general in Canada and in Ontario, do you feel that they've failed to address the importance of our immune system? Because I haven't heard Doug Ford or Justin Trudeau, for example, talk much about vitamin D or talk much about exercise or sleep, things that have been proven by science to affect our immune system in a positive way. Like, it doesn't seem like our politicians have placed any responsibility whatsoever on the citizens of Canada to make sure that they have a robust immune system and to do everything within their power to make sure that their immune system is functioning optimally.
Yeah, I mean, obviously, you can have the best immune system in the world and still catch COVID. So I don't think it's a silver bullet. Obviously, intuitively, it makes sense that if your immune system is working better, then the impact of COVID would be less. And certainly, when you look at the vaccine strategy of governments, they did target for early use of vaccine people with immunocompromised systems. So clearly they knew that lack of immune system made you a lot more susceptible to COVID, and the converse must be true as well. And I look, I pine for the world where we once again can make our own risk assessments as individuals and human beings. And those of us who are more risk averse, God bless you, stay at home more, wear a mask more, don't go to the Leafs game. I get all that.
Mhm.
That's your choice. I respect your choice. I want to make different choices because I know my personality. I'm more I accept more risk. Hell, I was a politician for 25 years. I must accept more risk. Yeah, certainly, that's the way my career went. So I accept more risk. I want to be sensible with my risk, but I'm willing to accept more risk, and that includes congregating with people, with strangers. That's what a rock concert is. That's what a Leafs game is. Whatever. So I want to get back to that world, and people will make choices in their lives, and hopefully most of them work out well. Sometimes they don't, but that's the cost of being a social animal, which I think has other benefits for human beings.
Okay. And do you think, there was maybe about a few weeks ago or a month ago now, Patty Hedju had said that, she thought that vitamin D was fake news. But, I've looked at the evidence, a lot of other physicians have looked at the evidence, and we feel that, vitamin D is actually very effective overall for decreasing rates of infection, decreasing rates of hospitalization, and decreasing rates of severe illness and death. And, I was just wondering, what you thought when you heard Patty Hedju made that statement, and do you feel that we should be, advocating people to take vitamin D and to take more responsibility for their health?
Well, I can't advocate for anything. I take vitamin D every day. I can tell you that much. Have done for years. I did so when I was a health minister, and I think that's I think that's proper, especially when you live in Canada, to have a bit of a supplement of vitamin D. So again, Doc, your point is obviously people should know more about how their immune system works, what can boost an immune system, what degrades an immune system. That's just smart health. And if your point is we should be smarter about our own health and learn about our own health, I'm with you 100%. And intuitively, because I'm not a doctor, so I work on my intuition. Uh, Better immune system is just going to be better for you overall. So why wouldn't you want that?
Yeah, I think that,
Get
some
more
people.
sleep. Get more sleep.
Yeah, I mean that's really been proven. Sleep has legitimately been proven to enhance our overall immune system. And a lot of people who actually do get sick from COVID, it's because they're run down, so to speak. So they're not sleeping well, they're overworked, and they're in a position where their immune system is down, and then when they get the bug, it's going to be a lot worse. But obviously, if your immune system is functioning properly, and you get the bug, you're going to have a better chance to fight the bug or fight the virus. So I always tell people to avoid high sugar foods, because again, when you get high blood sugar or hyperglycemia, that has been shown in studies, again, medical studies, shown to reduce our immune system response. So has the use of or eating ultra processed foods, that can decrease our immune response. And not getting enough exercise is also associated with a lower immune response, and not getting enough sleep. And then the last thing too, which you mentioned, is vitamin D. So, those five
Yeah.
things are things that I tell people all the time. But again, like you said, Tony, like you should be doing all those things anyway. Like you were taking, the vitamin D anyway prior to this.
And that's why I was recently tearing my hair out in Ontario here when outdoor activities were banned for so long. When we are trying to get people to exercise more and to go outside and to breathe fresh air, and it helps you psychosomatically as well. So, and then we were the only jurisdiction in the world that banned golf for a period of time. Yeah, it was absurd. So Again, that's what happens. I could see how that could happen. So you have these politicians that are seeing rising ICU cases and rising cases generally, and then the advice, somehow their advice was reduce mobility, and so they take that advice and then they do it in the stupidest way possible, and again don't deal with some of the core issues about workplace transmission and sick leave and those kinds of things. And then people were tearing their hair out because and then they start disregarding anyway, because people are people. And if there's one thing we should have at the science table that you were mentioning earlier, Mike, in the future, have a social psychologist or a behavioralist there who's going to say, yeah, you might think that doing this lockdown in this way is good, but here's how people will behave, right? Because it's all behavioral psychology, and you want to, when you, especially when you're dealing with something like this time a year ago or 14 months ago, yeah, ready, I'll lock down because it's for the greater good. 15 months in, man, I don't know a single person who was completely locked down. Oh, I know I was visiting my friend, but I know him. He doesn't get into any risky situations, so I'm sure I can visit him. That was happening all over the place because people are fed up. So this is the problem with lockdown whack-a-mole. If I can get back to that point, nobody was being creative with the solutions because people were getting tired of it, and then mistakes happen and outbreaks happen and so on. They've got another outbreak in Melbourne, Australia, and they had the tightest lockdown I've ever seen in the Western world. People are people, man. They're not going to be locked down forever.
Yeah, I think that, the lockdowns have definitely affected a lot of people, mentally, and that should be, as to your point, like taken into effect, or taken into context when people are making these decisions. And unfortunately, they weren't, and it's got to be evaluated as a trade-off. It's, what are the risks and what are the benefits? And then, unfortunately, I know at the beginning of COVID, we didn't have that much data. But now, we do have more data, and
that's the thing.
we should be able to make, better decisions based on the new data that we do have.
And you were asking me about Patty Hajdu and the other politicians, and I gave them a lot of leeway for the first 12 months of this crisis because I know how hard it is to make decisions in that situation. But when you're into month 16, presumably we've learned some lessons, I'd like to think.
Yeah.
So let's apply those lessons.
I agree. Unfortunately, Tony, we're kind of running out of time here now. So, if you can just let everyone know where they can find you online, and where they can learn more about you, maybe mention your own podcast, that'd be wonderful.
Yeah, sure. You can find me on Twitter at Tony Clement CPC. Same thing on Instagram at Tony Clement CPC. My podcast, you can see all the legacy episodes and Another Thing podcast.ca. Podcast is available on iHeart and Spotify and Apple and all the places that you find podcasts. And we've got a new tie-in with Looney Politics. There's exclusive content there as well. So lots going on, and love to interact with your clientele there, your viewers. So let's keep in touch.
Thank you so much for coming on, Tony. It was absolutely an honor, no pun intended, and can't wait to do this again.
Right on, Mike.